Do you know oral cancer accounts for over 1,40,000 deaths annually across the world? And over 3 lakhs people are diagnosed with oral cancer each year. So, my dear friends, today myself, Dr. Prakhya, is going to discuss about oral cancer. How many of you have come across the people who often smoke or who often use chewed form of tobacco? Quite often, right? So, please let them know that it is detrimental to their oral health as it can cause oral cancer. Oral cancer begin as red or white patch in the oral cavity. Oral cavity means mouth. It can occur anywhere, say on your tongue, especially the anterior two-third. It can occur your lips, cheek, gums, teeth, anywhere. This red or white patch in the early stages is usually painless, and it causes impairment in the speech, difficulty in swallowing, difficulty in chewing. This red or white patch is known as leukoplakia or erythroplakia, which is known as early lesion of oral cancer. Now, how does the oral cancer develop? Whenever there is an abnormal cell growth or whenever there is a nodular mass seen inside the oral cavity, or when there is a persistent non-healing ulcer, if combined with carcinogenic substances, by carcinogenic substances I mean to say cancer causing substances like tobacco and smoking, all these factors when they combine, they lead to oral cancer. Now, how does it gets irritated? Okay, how does the inside of your mouth gets irritated and it develop into oral cancer? See, whenever there is a sharp or broken tooth, whenever there is a broken denture, please visit to your dentist and get it corrected. Okay, because this can irritate inside of your mouth and this can cause abnormal cell growth. Some people have the habit of chewing inside of their lips or cheeks unnecessarily due to stress. This develop into leukoplakia or white patch. Okay, and as discussed, leukoplakia is the early lesion of oral cancer. So beware of all these habits and visit to your dentist for the early inspection, so that they can diagnose it early and send it to the oral pathologist and get your correct diagnosis. The cancer and the lesion which develops inside your mouth or on the lip is a potential sign of squamous cell carcinoma. Now, what are the symptoms or signs of the oral cancer? As discussed earlier, any persistent non-healing ulcer. By non-healing ulcer, I mean to say the ulcer which does not heal even after 2 weeks. Whenever there is a thickness seen, or whenever there is a rough red or white patch seen inside the oral cavity, if you feel loose teeth, if there is a difficulty in swallowing and chewing, these are all the signs and symptoms of oral cancer. Now, abnormal cell growth usually appear as flat patches. A canker sore looks like an ulcer, usually with a depression in the center. Middle of the canker may appear grey, white, yellow, and edges become red. So, look for it.